Bismillahirrahmanirrahim. Assalamu alaikum. Today, our topic of our discussion is causes of obsessive compulsive disorders. What basically we studied before was the psychological disorders, their classification, and mainly the symptoms associated with the disorders. Today, we will study about the psychological and biological causes of OCD. Psychological disorders, first of all, psychological symptoms, will be negative reinforcement of compulsive behaviors. For example, washing hands repeatedly is negatively reinforcing since it removes the anxiety of thinking about germs. Next is the biological. Dopamine appear to be neurotransmitters most correlated with these disorders. What is considered in this disorder is the imbalance of serotonin and neurotransmitters dopamine that exceeds its limited amount or becomes decreased in limited amount, so an individual face OCD. Depressive disorders, examples of depressive disorders: major depressive disorder, sad mood, loss of appetite in activities, feeling of worthlessness, sleeping difficulties, lack of motivation, and symptoms repeat for 2 weeks at least. Persistent depressive disorder, the symptoms that have been experienced for at least 2 years. Because criteria for MDD are not contained in PDD, it is possible for someone to be classified as exhibiting both disorders. Causes of depressive disorders: psychological causes, negative schemas for self, ongoing experience, and future cognitive triad, lack of reinforcement, regression, and introjection after actual or symbolic loss of loved ones, loss of meaning, incongruence. Biological causes are some sort of dysfunction of a neurological circuit that includes the prefrontal cortex, hippocampus, amygdala, and areas like 25. This circuit is rich in serotonin. Abnormal serotonin genes are also targeted as the area or specifically for depression. Bipolar disorder: for a person to be classified as exhibiting this disorder, the person must have exhibited a manic episode. For a person who has suffered from manic episode, mainly face persistent, elevated, expansive, irritable mood and includes such problems as elevated, inflated self-esteem, decreased need for sleep, flight of ideas, and destructibility that last for at least 1 week. The criteria is the symptoms should last at least 1 week. Otherwise, we cannot classify it as bipolar. We can only say the person is facing mania episode, the person is facing the struggle with the life, so he is acting or he is taking something in his nutrition. Nutritionally, he is taking such stuff that he is facing manic episode daily. We can say that we cannot consider it a patient, or we cannot consider that a person is having bipolar disorder. Next is manic episodes may include hallucinations and delusions. Depressive episodes may or may not be present. Depression इसमें हो भी सकता है और नहीं भी हो सकता. Manic episodes may include hallucinations. Hallucination are basically what we don't see is appearing before us. We don't consider this. Other cannot see, other cannot smell, but we are facing difficulty through our senses. 5 senses are distracted on daily routine. Biological may be related somewhat to norepinephrine, serotonin. We can say our neurotransmitters are facing increase in level, or we are facing decrease in level of these neurotransmitters. Now, schizophrenia spectrum and other psychotic disorders. We can also say that a person who is facing schizophrenia, he is not a normal person. He is basically going towards psychotic ailment. And we have classified this as psychotic ailment as well. Schizophrenia consists of several problems associated with several psychological processes, including delusions, hallucination, disorganized speech, grossly disorganized behavior. It is really, really harmful disease. If one person faces it, then he is facing delusions as well. Delusional disorder: the presence of one or more delusions, false beliefs a person holds in spite of evidence to contrary and in spite of what others believe. He faces basically false belief about everything. Causes of schizophrenia spectrum: we move toward the schizophrenia spectrum, what are the basic causes? It may be through genetics, biological, we can say, and this could be psychological. Now, psychological may be external personal attributions for negative events, operant conditioning of peculiar behaviors, attempting to make sense out of peculiar perceptual experiences, family stress and dysfunction. बेसिकली फैमिली स्ट्रेस की वजह से भी schizophrenia हो सकता है, एक्सटर्नल फैक्टर्स की वजह से भी schizophrenia किसी भी इंडिविजुअल सफ़र कर सकता है. Biological, biochemical abnormalities like dopamine and perhaps serotonin abnormalities in frontal and temporal lobes and in brain structures such as the hippocampus, amygdala and thalamus. These are the basic structures which are affected, so a person faces schizophrenia and difficulty in moving in daily function activities. And keep in touch, subscribe my channel, like my page and follow. Thank you so much. I have given the following link in my recent slide. Thank you so much.